I have an autosomal dominant neurodegenerative disease called Machado-Joseph disease, and it's a form of hereditary ataxia. So meaning it was passed on throughout my family tree and generations. I've lived with it my whole life, but I didn't know I had it till the last 4 years of my life. Now that I know that I have it, life has more meaning in some ways today than it did before, and every day is valuable and precious. Primarily gait and balance are the main things that are affected with Machado-Joseph disease. There is no cure for what I have, but there's lots of promise today. Working with the Tutor treadmill has greatly helped me in so many ways. I used to walk with a walking aid. This is all in the past. I no longer use an aid for walking. I would also use my eyesight for walking. So meaning that I would have to focus and concentrate on the steps that I made so I wouldn't lose my balance and fall into things. But today I walk without any aids, and I march up and down stairs without looking down and without using my eyes. I autonomously can walk normally, which really feels good. So the BalanceTutor is the best machine that has come into my life for balance with technology, and it really works on your coordination with the brain and your balance. It works to reconnect things that wouldn't be able to connect without it. It's a computer and a treadmill, so it will take data and will also find the spots that you need to work on for physical therapy. And you have like a real compass that can guide you through this. So it's a great machine. It's helped me. Amazing is a word I would describe it, yes.
The MediTouch BalanceTutor has been a wonderful piece of equipment. It's a great way to train patients with any type of diagnosis, especially neurologic and orthopedic. We are able to train the balance reflex for the slip and fall. So these patients that come here, they have a hard time when they're out on the sidewalk or uneven surface. And so what we're able to do is put them on here and give them it's called a perturbation or a force that will force them outside of their base of support. What they do is they're able to take a little step that's kind of unexpected, and with that, the brain takes over and it causes them to step. If they can't step, the harness will catch them, which is really nice. It's a safe way to train. The patients really benefit from that. We can also use outside equipment in addition to this treadmill, so it doesn't get boring for the patient. We use busy boards that have wrapping paper on them and numbers that we can flash at them and have them call out the alphabet or numbers. We also use aids that are around the room. They have to turn their head and look at it. So a lot of head turning. We bounce balls at the patient that they have to catch while there's a perturbation going on the treadmill. The patients can walk forward or backwards. So there's lots of options. It's a great way to retrain the brain, and not only that, but there's so many research articles out there that supports that this treadmill works and that the training that you receive on this treadmill will last and is effective for crossover into real life situations. And so our patients love that as well, because they'll come back and say, I haven't fallen in 6 months or so, and it's really been a wonderful piece of equipment, and I'm so glad I invested in it.